everyone, my name's Natalie and I'm a member of the Arena Futures Committee. I speak for myself, the rest of the committee and the Director of Arena, Lorraine, when I say that we're really excited to welcome you all today to the second part of our mini event series, Develop Understanding the Cost Sector. Before I get started, I just want to clarify a few technical points. So we will be holding a Q&A session after we've heard from our speakers. If you'd like to submit a question for this, please could you use the Q&A box. The webinar will also be recorded and you can get a copy from Lorraine by email or on our LinkedIn Arena Futures page. At the end of the webinar, there will also be a link to a short survey where we'd like to get some of your feedback in terms of what you enjoyed about today's session, what you thought maybe we could improve upon, and what you'd like to see from us in the future. So we'd be really grateful if you could spare that time. For those of you who don't know, Arena Futures is a subdivision of Arena, the Food and Hospitality Network. Our purpose is to connect the next generation of industry professionals or those who are simply new to the industry with the existing professionals within the Arena network. This is to facilitate an inclusive industry where everyone is confident and can connect, develop and grow. This is the mandate that is behind all of our Arena Futures events. So the cost sector is responsible for providing food to places such as prisons, care homes, schools and hospitals, to name a few. And whilst we've heard a lot about the profit sector, the cost sector has continued on in full force, especially healthcare. So the purpose of today is to help develop your understanding of this element of food service. To help us do this, we have 3 experts from ISS Facility Services. Focused on providing integrated facility services to its customers, catering is one of the services that ISS specialises in. So our speakers today will share their knowledge and experience of healthcare catering, the challenges they've experienced over the past year and what they expect the future will hold. First up, we'll hear from Craig Smith, who will take us through a general overview of hospital catering and the role of the Hospital Caterers Association. Craig is Head of Corporate Affairs at ISS and has more than 40 years experience working with the NHS. He has helped to develop ISS Healthcare into a market-leading provider and retains a strong interest in hospital catering. Next up, we'll have the pleasure of hearing from healthcare dietitian Leanne McDowell. Leanne is co-secretary of the Food Services Specialist Group of the BDA and is currently working on the 3rd review of the industry guidelines. Leanne joined ISS in 2018 and is responsible for the day-to-day dietetic support to operations managers. And then we'll actually hear from an operations manager, who is May Bananuba, who joined the ISS Management Trainee Programme in 2018. She has worked in various roles across the business, such as HR, within finance, on the RBS contract and on the government's Business, Energy and Industrial Strategy contract. And then just as the pandemic struck in March 2020, she joined Clatterbridge Cancer Centre as an operations manager to help to mobilise the centre 3 months before it opened. She is now one of 5 zonal managers who look after 110 staff, providing catering, cleaning, portering and security services at the centre. So once we've heard from Craig, Leanne and May, and I can see Craig is raring to go because he's got his slides ready, we'll then have a Q&A from being led by Victoria Joseph, who is another member of the Arena Futures Committee. So now I'll pass over to Craig for his overview of healthcare catering. Thank you, Craig.
Thank you, Natalie, and thank you for such a nice link there. Because in our dress rehearsals, we have to say that it took quite a few seconds for the slides to come up. So I hope that everybody can now see the slides in their full colour and we can proceed. Because what I hope to do today, along with my colleagues, is to demonstrate to you a sector that perhaps you might not have considered in the past. And we'll be covering how big the sector is, what opportunities are out there for everybody, because you've already heard I've been in the industry for 40 years now, but I'm really passionate nowadays about bringing the next generation into this so that they can share in a a part of the hospitality sector, I really do think is something which is really rewarding. And what we'll be doing is we'll be talking about how COVID has affected us and looking at the size of the industry. But to start off with, before we go any further, I'd like to just share a quote, which was written, or first of all was crowned by Steve Genshi from Compass Group, who he runs their healthcare service. He used it in a speech, and since then it's become so popular that not only have I nicked it, but Prue Leith has used it on more than one occasion when she's actually introducing hospital catering, because Steve actually started like this. Imagine a restaurant where 1,000 people must be fed at once, where your kitchen is half a mile away, where your chefs cannot season the food without written permission, where half your customers feel ill and none of them want to be here anyway, where menus must include options to satisfy dietary, medical, ethnic, and religious demands, where 66% of your diners are between 65 and 90 years old, and where your budget for a 3-course meal and a drink, 3-course meals and a drink, is £1.49. Welcome to the world of patient catering. Now, to many people who have been working in the traditional catering environments, that sounds a heck of a challenge. Well, it is, but it's met every single day. Up and down the country, we have some 1,900 hospitals here in the UK. Across the 4 nations, 142,000 beds, serving all kinds of different patients. In England, Scotland, Wales, Northern Ireland, we have different NHS bodies who demand the standards that they want to achieve in their parts of the United Kingdom. And that's right, because we're actually reflecting the service that our local people need. And that's something which is really important to us. But everybody knows the NHS. Everybody's been standing outside in the early part of COVID, clapping outside to say thank you to them. But did you know that the NHS employs 1.2 million people? That's a huge amount of people. And I think it's something like 2% of the entire population works for the NHS. 6,000 of those actually work within the catering departments. And that's really where I want to be focusing now, because the size of our operations is quite immense. We feed 125,000 patients per day. That's 140 odd million meals per year just for patients. And then, of course, we've got all the other sorts of catering that goes on for staff, visitors, and for hospitality. Combined, we spend around £634 million a year on hospital food. And that's the latest recorded amount that's been put up there. So presumably nowadays we're spending slightly more than that. But the Hospital Caterers Association, you see the logo there, it represents the hospital caterers, who are the second largest caterer in the country. The first largest group of caterers is of course schools, because every small village, town, whatever, all have their schools. So the schools being the largest caterer, we being the second. We've been representing the hospital caterer since the NHS began. We were the first professional body to be created once the NHS was created more than 70 years ago. So we're really quite proud of that. You can find out about the Hospital Caterers Association on our website, which is hospitalcaterers.org. The purpose of the association, though, is for the promotion and the improvement of standards of catering across the board in all hospitals. We look to the education and training for everybody that's involved in those hospital catering operations, and we look to the improvement and development of our people's professional developments. When I first joined the NHS, I was told on a course, when I only been there a little while, that if I was serious about a career in the hospital catering, then you had to be a member of the hospital caterers. I was young and keen, and I took the advice of a young man or an older man at the time, and it's true today. I'm still in touch with that man. 40 odd years later, I have a tremendous network of friends and colleagues and great memories, all thanks to the Hospital Caterers Association by keeping us all together. But I think that it's really a very good organization to be part of, because the hospital catering offers every kind of opportunity for hospitality. If you want to be in an acute hospital, and that's like a general hospital or a maternity hospital, or you like working in mental health, or even in community, we have community hospitals they're a lot smaller and they serve local communities. Each of these are very, very different types of environments. And I have to be perfectly frank, I have enjoyed all of my time working in acute hospitals. And I do know the benefits and the joy that can come out of working in community unit. But I take my hat off to anybody who is working in the mental health unit, because that calls upon a certain type of person who really is engaged with other people and really, really wants to help. So I'd encourage anybody to look in each of these kind of sectors when they're looking at healthcare, because we offer all kinds of catering. We do fresh cook to delivered meal services. We have central production units. We have cook chill operations. We have cook freeze operations. And also we have a different full range of chefs and their abilities. Because of COVID, a lot of people have been finding in hospitality, it's closed down. Chefs just love to cook. That's quite simple. And so what we've been finding is chefs from all kinds of environments have been coming into our business and saying, do you know what, have you got any vacancies? I just want to cook. And at Great Ormond Street, I was talking to the catering manager there recently, and she was saying she has 2 Michelin-starred chefs working at Great Ormond Street at the moment, quite simply because they want to give something back to the community, but they also want to cook. And that's fundamental to most of us in the catering industry. We just want to be involved, and we do everything in healthcare from the farm to the fork. We're very passionate about our sustainability and where our food comes from. It isn't just because we're a very large organization, but we care about the local suppliers to us. There are many, many caterers around the country who depend upon local suppliers coming in to keep their services going. But in return, those local suppliers depend upon their hospitals as well for continued service. And we do all sorts of catering from secure hospitals, as I've mentioned, in the mental health units like Broadmoor and Rampton, because even in there, patients need to be cared for. Up to penthouse events. And why am I talking about penthouse events? Well, the 2 pictures on the right hand side there are hospital environments. Okay, and one is decked out for an afternoon tea as a special function, but it just goes to show the level of detail that we can go to. The other picture, and I hope you can see it clearly, is the Rubens Suite at Guy's Hospital. And there you can see that they are taking on all the hospitality industry along the River Thames there, and their views compete with everybody. And we can do everything from feeding a young baby right through to these top-notch kind of penthouse events. So there's something there for everybody. We also have the challenge in this very complex area of having to meet everybody's demands for cultural feeding. And for the multiple diets. But I mean, Leanne's going to come back and talk about that in a little while. But we also have retail opportunities. We have started in usual circumstances, of course, not least sort of before COVID, and we will get back to it. We have retail opportunities as well. So we actually run franchise operations like Starbucks and Costa coffee shops in our operations. We in ISS we have something like 3 Subway franchises which are operated within a hospital environment, but we still have to maintain those exacting standards of the franchise that we bought, like Starbucks, like Subway and everything. So there's plenty of other opportunities other than just simply feeding the patients. But that's a really rewarding thing anyway. And so how has COVID affected hospital catering? Well, unlike a lot of the other hospitality, our hospital caterers have had to stay at their posts. They have never been more wanted and needed in the whole of the community. And it was a testament to the number of hospital caterers who stayed at their posts throughout this, and they didn't know what was going to be thrown at them. Hospitals had to remain open for their normal business, which was feeding the patients and also the staff. The picture there, though, shows one of the Nightingale hospitals. This one is the London Nightingale Hospital. And at the time, when it was pulled together, we didn't know exactly what we were going to expect. This hospital was designed to hold 3,000 beds. 3,000 COVID patients would be admitted to this hospital, and they would only be the worst of the worst because that was the nature of what was being built here. That group of people in that picture all were volunteers. They all wanted to come in because they wanted to make a difference and to be serving their communities. They didn't know what they were going to expect. They just wanted to be there to serve because they were needed. That's the camaraderie that you kind of get with people working in the health service. And then we had staff welfare. The restaurants and the coffee shops and everything all had to shut down because the visitors weren't coming into the hospitals. But the staff were working exceptionally long hours and they had to be looked after. And that picture there shows a number of staff at one of the hospitals where, and it wasn't unusual, local suppliers were providing food for free and drinks. They were just bringing in stock and giving it away to hospital staff just to say thank you. Thank you, NHS, for all the things that you've been doing, because these girls and boys have been carrying the nation for so long throughout this COVID crisis. And that, as a hospital caterer, has been a really amazing thing to be working with. But what it's done, it's also given us opportunities. One of these chefs in Norfolk actually has now been commissioned as a patron chef to his local hospital because of the links that he's built up with the hospital in Kings Lynn. And now he is advising them on hospital menus and bringing that up to date for the needs of the current, the patient's needs nowadays. So what it is for me, I believe it's hospitality with a heart. That's what I'm really passionate about. To share my story, and everybody, I believe everybody has a simple story in hospitality in healthcare. But after 2 years at college, I wanted to get out into the real world and get a proper job. And I was very, very fortunate in landing a traditional hotel training manager scheme, which I did in London. And then I moved out into the provinces. Once I fully qualified, I was an assistant hotel manager in Liverpool, and I was dead proud of myself. And I really sort of was enjoying my life. The work in hotels was fantastic. I really, really enjoyed it. But fundamentally, I wanted to move back down south. And for perhaps the wrong reasons, but one of my friends is a dietitian. She still is a friend, actually, all these years later. And she said to me, there's a hospital where I work and they want an assistant catering manager. Perhaps you could apply for that. And it was down south. So I applied and I got that job. And I moved down south, perhaps not for the right reasons. I went into the hospital and I thought, well, if it doesn't work out here, I can always go and find a hotel nearby. And I worked there for a little while. And one evening I was sitting at my desk. We were doing the supper service and I got a telephone call from Ward 5B. Sister Cooper. She was a very forthright lady, but she said, I've got a patient here who's dying. Dying, yeah. And all he wants is an omelette and some orange juice. Now, young man, what are you going to do about it? And I went out in that kitchen and I cooked that omelette because it suddenly dawned on me, me, was making a difference to somebody. And that is what we are doing every single day here in the health service, in health service catering. It is making that difference, be it a patient sitting there having a little laugh, as you see with the ward hostess there with the cake, or perhaps in their last days, okay, or getting them back. You know, it's really nice feeling when you see your patients walking out the hospital again saying thank you. But you don't have to take my word for it about this being a really good opportunity. This is Sir Simon Stevens. Simon Stevens is the chief of the NHS, and he actually announced his retirement recently. What he said was that joining the NHS in his 20s was one of the best decisions he ever made. And I believe that I was in my 20s when I joined the NHS, and again, it was the best decision of my career that I have ever made, and I'm really, really pleased about it. But to come back into the catering operations, they are very complex. I've already mentioned we serve over 140 odd million meals a year just for patients, and they're patients who are perhaps healthy, other than perhaps they have a broken leg, or they've just given birth to a baby, or somebody who needs really complex care. And because of that, it takes great teamwork. We have to work with the clinicians, with the nurses, and most particularly for us, we have to work very closely with our dietetic colleagues. And what I'd like to do now is to pass you on to Leanne, who's going to talk to you about the nutrition and patient catering and how that fits together. So Leanne, over to you.
Thanks, Craig. That was a lovely story. I haven't heard that one before. It's great to talk to you today about nutrition and patient catering. It's obviously something I'm very passionate about. I've worked with ISS now for 3 years as their catering dietitian. And prior to that, I was a Macmillan dietitian working for the NHS. So I supported cancer patients through their cancer journey and beyond. I came into dietetics later, so I'm a great example of how you can change careers or move in a different direction. And obviously, I've never looked back, and I've taken with me all the skills I've learned in my previous career through to being a dietitian. So catering in healthcare, like Craig has said, is so rewarding. It's complex, it's varied, and you get to work with some amazing people. And catering for patients has different challenges to those for staff and visitors. However, at the heart of both is obviously providing nourishing food that they want to eat, that they enjoy, and that's good for their health. If you think about it, you know, in our hospitals, there's no better place to promote health and well-being. As the name says, we are healthcare. And I think our restaurants are full of sort of, we say healthy, but well people that come in. It's a welcome break from their jobs at lunchtime. They're hungry. They're eager to try what's available. They haven't many dietary restrictions, maybe just the odd allergen. They sit down in a lovely environment in our restaurants where they're airy, they're modern, and they sit and chat to their friends and colleagues, and it's a social event. And you can actually capture that all around you, where people, their enjoyment of food. And then you take that same food and you put it onto a hospital ward, as you see there, and the experience is totally different. So as you can imagine, patients, they're in hospital because they are usually unwell. So they may be feeling sick, they may be in pain, they may be anxious or scared about what's coming up, or what procedures they may be having. And then alongside how they're feeling, they're on a ward which is quite alien to them. It's warm. There's noises they don't understand, there's bleeps, there's medical staff talking about procedures, surgery, and there may even be somebody opposite them that's upset because they've just had some bad news. So the ward environment is not that conducive to eating and drinking, and really that's our challenge in healthcare, is how do we get patients to eat and drink, because we know nutrition is important. So there are many barriers that we need to overcome, and that's really the challenge, is how do we find solutions, how do we break down those barriers, how do we make a difference, how can we bring innovation onto the ward to make the environment nicer, how do we make sure what we give our patients to eat and drink is what they want. And that is the ongoing challenge, but it's a rewarding one. And I think there's the hospitals give us the opportunity to make a difference. So that can be because, like Craig has already mentioned, it could be you taking a birthday cake to a patient that's been on the ward a long time, but they've got a special birthday. It can be that you're providing a meal for a patient that's got quite complex dietary needs. Also, it can be that you just stop and smile, ask a patient how they're feeling, how did they enjoy their food, what can you do for them? And it makes a huge difference to patients. Even though you probably won't know that, I think catering staff offer that. They can be a little bit scared of medical staff and what they might say. So we just seem like normal people to them on wards. So we get to get those opportunities to make a difference and go that extra mile. And if you just think about how you feel when you've done something good for somebody, a friend or family, and how that makes you feel inside, times that by 10, and that's how you feel working in healthcare. You take a real pride in your work, and it makes you feel so good that you've done something or made a difference to someone's life. And that means we get to go home every day feeling like we've made the world a better place, really. And I don't think there's many jobs or careers that can actually say that. Okay, so how do we get it right for our patients? Now, we know that 30% of our patients are malnourished, and talking about malnutrition, because not everybody will know what that means, that can be somebody who is underweight for their height, but also somebody who is overweight and obese. And we know that somebody who's malnourished, that it shortens survival time, increases their length of hospital stay, post-op complications, so it takes longer to heal, impairs their immune function, and reduces their quality of life and how they feel, their mobility, being able to go to the toilet themselves. And so we know that nutrition and hydration have a positive impact on all these areas. So in fact, it makes patient feel better, stronger, they heal quicker, they recover, they get home to their loved ones quicker, and ultimately also reduces NHS costs, meaning there's more available or beds available for the next person. And menu planning, as you can see, has its complexities. So we need to think about not just, so we're looking at budgets, and we can be looking at storage and suppliers. And alongside that, we have to think about the patient's needs. So each trust can be different. So in mental health, we'll be looking at patients that are maybe hungry because of the medication they're taking, but we've also got to look after their health and maintain their weight. So we have to think about what we put on the menu. Is it predominantly healthy meals and snacks? And do we make sure there's enough fibre on there so it keeps them fuller for longer? Where maternity, we might think more about flexibility, because babies do not necessarily ensure they arrive before the meal service. They come at all times of the day. And then we have to think about clinical specialities. So in that trust, does it have an oncology ward? So we have to think about patients when they're going through treatments. You know, they're symptomatic, so they may have sore mouths or they have taste changes, and how do we reflect that in the menu or our food offering? And then dysphagia is for people with swallowing difficulties. So we need to make sure we include meals that are modified texture, which allows that patient to eat and drink. And also it's, again, like Craig mentioned, it's a collaborative approach. We can't do it on our own. We have to work with our catering managers and operators. We also ensure that patients are at the centre of those decisions, and we look at their feedback and what they'd like to see on menus. We also have to work with nurses and the dietitian specialities, because we'll have renal dietitians and we'll have oncology dietitians, so they all get involved. And speech and language therapists, so they give us support around the modified texture meals and the patients with swallowing difficulties. So it's an absolute collaborative approach to menu planning, and as you can see, it's quite complex. And alongside this, we have to ensure that we go along with, we meet legislation, standards and guidance. So you may be more familiar with the government buying standards and the Food Standards Agency. In healthcare, we also have to adhere to the hospital food standards and also the BDA, so that's the British Dietetic Association, and the Nutrition and Hydration Digest. So these support us to deliver a good quality food service within health and social care. And patient menus. So you're probably used to going into establishments and they have a set menu, but in healthcare, we can have probably a minimum, I would say, of 10 menus that are available at any one meal service, which is a lot of menus and a lot of meals, and takes some organisation. I mean, when you go into hospitals, you'll see the standard menu, and this usually meets the needs of the majority of the patients in the hospital. Unlike manufacturers that you might be familiar with the traffic light system, which draws your attention to fat and salt, etc. In healthcare, this isn't helpful for the patients that are trying to get better, so we don't want them to be looking at salt or fat. So we use coding instead. So we ensure on the standard menu that we have meals that are suitable for people that are malnourished and underweight, and we code them as higher energy so that patients that need more calories, they can choose those meals. Again, with people that need to maintain a healthy weight, who maybe have diabetes or heart disease, we will code the menu with hearts so that they know which meals are healthier options to choose. We also use V for vegetarian meals and puddings and snacks. And also we use a coding called Easy to Chew. So in the hospital setting, especially with predominantly elderly population, we can have people with dentures or missing teeth or sore mouths after treatment. So we have to ensure that this group of people are able to have foods that are soft and easy to move around their mouth so that we can actually provide nutrition support. Alongside the standard menu, we'll have specific groups that we have to meet the nutritional needs of. So children are very different to, say, mental health, and then dementia. So we find a lot of dementia patients need more calories. We might provide a finger food menu so that they can actually feed themselves. It's more dignified. We may provide a pictorial menu so that they can see more easily what the food looks like and make their own choices. We also have to provide menus for therapeutic diets. So we've already talked about dysphagia, which is swallowing difficulties. So for those patients that maybe had a stroke or they're progressing with dementia and their swallow becomes weak, we have to provide meals that have been adjusted, so they've been modified to a pureed or soft and bite-sized, so that that patient can swallow those safely and reduce aspiration, which is those foods going on to the lungs. So you can see it can get really quite complex. If we have a renal department, we may have to provide a renal menu that is lower in potassium and sodium. And likewise, a liver ward, we may do a different menu for them. And we also have to meet religious needs, so that can be halal and kosher, cultural menus, and also personal lifestyle. So people may want to be gluten-free. It may be a personal choice, it may be medical. And these days we're seeing vegan diets more popular. So a lot more patients are asking, because they've adapted what they're eating and they want to follow a vegan diet. So they're all the considerations we need to make. And then lastly, test or investigation diet. So it might be that we provide a liquid diet or a very low residue diet for somebody who's had gastric surgery and may need to rest their bowels. So as you can see, lots and lots of menus, lots of collaboration, but really, really interesting as well. So training is central to everything we do in healthcare because it's really important. Our priority really is patient safety and also the patient experience. So we take this really seriously. At ISS, we have a training academy which any new staff will attend. So they'll have mandatory training, but for those that go into catering, we give specialised training around food safety, which is really important, and allergens. We also give specialised training around special diets. We teach the importance of nutrition and hydration, because I think that's really important that our staff understand why they do what they do and what the significance of that is. We talk about the meal ordering and the food beverage service, because it is a service with a smile. Like I said, patients really appreciate the input from our staff, because it may be, well, it's just familiar to them. A cup of tea and a biscuit midday, chatting to the hostess is something they look forward to doing. And we teach them to go that extra mile and how important they are in healthcare. Yeah, so lots of training. So 2020 was a challenge for all of us, especially in healthcare. And like Craig was saying, you know, our catering staff were our superheroes really, because they worked alongside the medical staff on the wards through this pandemic, day in, day out. And they did that because they wanted to get patients better, providing good food, good nourishing food, to make sure that they could get home to their loved ones. So for us, particularly staffing, when people were shielding and poorly themselves, we had to move people from retail into the patient catering. So they did have obviously lots of skills, but on the safety side of special diets, we had to do some quick training to ensure that safety was maintained. A food supply into healthcare. Luckily enough, we've done a lot of planning with suppliers around stockpiling for Brexit, so we were more than prepared when the pandemic hit, which was enormously helpful. And we had daily contact with our suppliers to make sure that they could continue to supply into healthcare, and looking at substitutions or emergency menus that we might need to put in place. But fortunately, there was only a few manufacturers that actually had to reduce the products they provided, and they just made sure that those most popular in healthcare continued. And then looking at how we supported patients, if we can just go back, sorry Craig, how we supported patients through COVID. As dietitians, we know symptoms like shortness of breath and fatigue, that patients do better on easy to chew, high calorie, high protein foods. So things like custard or yogurts, meals like shepherd's pie and cauliflower cheese. They're easier to sort of move around the mouth and swallow. And if you can imagine, when you're trying to breathe and you haven't got a lot of energy, these types of foods are more helpful. So it was making sure that we had a good supply of those in the hospitals, and also modified texture meals, because patients coming out of ITU that have been on ventilation may have a weak swallow, so we needed to progress them through the different textures back onto a normal diet. Another challenge was infection and prevention and control, so lots of our staff had to stay on their wards until their shift finished. They also had to give, most sites went to paper menus, because these could be discarded once the patient had gone home. So really just reducing that transmission of infection. And we also seen an increase in disposables, because where we had staffing issues, then obviously our priority was to provide the meals and make sure that the patients had nutrition and hydration. And obviously the cleaning, thrown away disposables was a lot easier. So moving forward in the future, so I think definitely this pandemic has shone a light on good nourishing food that's good for health, and I don't think that's going to go away. And you know, that's music to our ears really as dietitians, because it's something we've been promoting for a long time, and I think a lot more people are looking at what they're eating, about their weight and exercise. And I think we've seen the correlation with COVID-19 with the outcomes of obesity and diabetes. So improving health, I think that's the future, and thinking about our food more. Although meeting the nutritional requirements of patients in hospitals will always be our priority, we do need to think and consider about sustainability. So we need to think about reducing plastics. We need to think about reducing our carbon footprint and waste, but these are not easy. They are challenges in healthcare, but I'm sure we can rise to them. Also working with procurement, so making sure that we get value for money, but it's good quality food and what our patients want. Innovation, well, I think healthcare is innovation. You know, we're always looking at what can we do better and how can we do that. So innovation is key and something we will take into the future. And I think, again, embracing technology is something that I certainly have done in the last year. And I think IT and the data it collects for us, it informs our business decisions going forward. So I think we need to embrace technology, and also smartphones for ordering online from wards, or for the meal to actually move with the patient so it reduces waste. So lots of things to look forward to in the future. So thank you for listening, everybody, and I'm going to hand you back to Natalie.
Thank you, Leanne. That was really insightful. May, please could you join me? Because it would be good to ask you a few questions about your role as an operations manager. Obviously, we've heard already that you helped to mobilise the centre amidst the backdrop of a pandemic, so that probably had all sorts of challenges in itself. But if we just sort of focus on sort of the catering side of things, where is she? Is she joining me?
Hi, everyone.
There she is. Thank you. I thought you were leaving me hanging there.
No, sorry. I was just trying to get my screen up.
No, don't worry.
Joining everyone.
Okay, could you describe your day-to-day responsibilities at the centre from a catering perspective? Because I think that would be sort of really interesting to hear.
Yeah, so we have full-time catering staff on 4 of our inpatient wards, and we have 5-day case wards as well. So on a daily basis, it's just making sure that all staff are in. When we're at full capacity, which we haven't so far, we have about 110 beds, and they're each en suite rooms. So just making sure that if we need to move staff around, to make sure that all staff have the support they need to provide the meals to the patients at the right times. We do have what we call protected meal times, which means that breakfast, lunch, and dinner has to be served at certain times in the day. So it can be very reactive to try and make sure that we take the orders in time and that we deliver the food at the right temperature at all times.
Wow, okay. So in light of the pandemic and the fact that you're dealing with, you know, really vulnerable cancer patients, how do you need to serve the food? Do you need to use any sort of special crockery, or how does it work in terms of PPE and the required meal times that you've just discussed? Are there any challenges that have sort of arisen there, and how have you dealt with them?
Yeah, so because we've got particularly vulnerable patients in the hospital, we have 2 particular wards, for instance, who have the most vulnerable patients, and for each of the rooms, when we're going in to deliver the food to the patients, we have to change into fresh PPE per each room. And whilst usually if you didn't need to do that, you could serve 6 meals at a time on the tray, because we have to do that, it now takes longer to take food round. And so we found that we've had to increase the number of staff that we have usually. We've had to even ask the healthcare assistants to jump in and help deliver the food, or take them out maybe 3 at a time rather than 6 at a time. So we are using a lot more PPE in order to protect the patients from infections. So it is becoming challenging, but we all hands on deck. We've cross-trained all our staff to be able to, you can have a porter who can porter at the same time as cater, and we're just trying to manage that in order to prevent any cross-contamination, but also try and be a bit more efficient with the staffing levels. So it's been quite a challenge, but we've stuck together.
It sounds intense, it really does,
Yeah.
but it sounds as though, you know, you sort of all pulled together and have managed it, and you have to be reactive, you have to be flexible, and obviously put the customers at the centre of everything that you do.
Definitely.
Do you see the process of providing meals to patients becoming easier as the pandemic eases, or what do you think? Do you think there'll be long-lasting changes in the way that you do things and the way that the team does things?
So eventually, I think it will ease off slightly, although not soon, because I think with the extra protection that we've put on because of the virus has probably made the wards realize that it's probably for the best to maintain for as long as possible, just to provide any patients from having hospital-acquired viruses, as they call it, or infections. So I think it will ease off, and so that we can become a bit more, we can use a lot less PPE as time goes on. It will ease off slightly, but for now it's staying.
I don't suppose there's a space for sort of sustainability in all of this, is there? Are you able to sort of minimise wastage at all, or does everything have to be sort of single-use plastic and so on? How does that sort of play a part? Because that's obviously important, but the patient's well-being is paramount. So
that's right, yeah. So when we have a section of one of our wards where any cancer patients who then contact the virus stay in those wards, we used to deliver their food on disposable crockery. We were later advised by infection control that it was actually okay to use standard crockery for all patients, because they're then washed through the dishwashers. And so it, you know, we were able to cut down on disposable equipment at that point. So that was really good. I think eventually we are going to be looking at maybe cutting down on using extra PPE, disposable PPE as well. In terms of food, it's really good how it works, because we only ever cook the food that the patients have ordered two hours in advance before their meals. So we only ever pick what they've ordered, and we don't store any food at all. So that's also very good at minimizing wastage of food and, you know, crockery.
Okay. And just lastly then, what is your proudest moment as a manager to your team, who will have no doubt experienced probably the most challenging year of their life since the pandemic?
I'd say over the last 11 months or so, the majority of the team, including myself, joined the contracts with little or no healthcare experience at all. And we've been working so well with the client to provide exceptional integrated service to the patients. And it really makes me proud to think about. So we've got some of our kitchen staff who have received achievement awards for their care and attention to the nutritional needs of the patients on a daily basis. And as Leanne mentioned earlier on, if you think about it, some of these patients have been admitted for several months with no visitors allowed due to the pandemic. And the staff know that taking a meal to a patient's room, for instance, and having a quick chat with them for 2 minutes is probably, you know, the closest they come to ever having that physical presence of company. So it's been very rewarding, I must say, for all of us.
Yeah, it just goes to show that there's so much more to it rather than just providing a service. You know, there's obviously been providing, you know, so much more than that. And it makes me proud as an ISS employee to know that I'm sort of not in healthcare, but sort of part of that amazing company. So thank you so much. What I'm going to do now is I'm going to stop talking, and I'm going to invite Craig, Leanne and Victoria back for the Q&A session. So do you have some questions for the panelists, Victoria?
I do indeed. Thanks, Natalie. And thanks, Craig, Leanne and May. That was a really insightful discussion into hospital catering. We've actually had some really great questions come through during this session, and I think I'd like to kick off with you, Craig. A question's come in anonymously asking, what changes would you like to see going forward from a hospital catering perspective?
Okay. First of all, can I just sort of go back and say, Mabel, just fantastic. Everything that I was trying to get across in that, May's coming across and echoing, that is exactly what we have in healthcare, just so different, so different. But what do we want? Recently, there was, just as the pandemic broke, we had worked on what was called the Hospital Food Review. And I was lucky enough to be on the panel that actually produced that report for the Secretary of State. And basically, we came out with 8 recommendations about various things that we would like to see improved within hospital catering, all for the benefit of the patient and the staff that work within it. And it's recognizing the catering staff that's in there. It's recognizing that an awful lot of the equipment, I can take you to one hospital that I know personally, that when I worked there, we still have some of the same kit in the kitchen. And that is really not acceptable anymore. There is a huge investment needed in equipment in hospitals, and that's the things that I'd like to be seeing. I'd love to see this hospital food review really given the teeth that it deserves, and to be able to come up with all those recommendations to support everybody. If we do that, we'll certainly have a 21st century healthcare system.
Absolutely, thank you for that. And Leanne, I'd like to find out from you what food management systems are companies currently using to manage allergens and food quality? That's coming from Paul Kavanagh.
Hi, Paul. Yeah, I mean, we actually use Saffron is the system we use to manage and control the food that comes through. So our suppliers send the information and it's uploaded overnight. Any allergen changes, we have processes for that. So our sites just build their menus within the Saffron system and then able to print off the allergens at site and make them available on every ward.
Okay, thank you for that. And May, this is an anonymous question, but it would be quite interesting to get your view. What advice would you give to someone considering a career in hospital catering? This has come through anonymously.
Okay, I would say to the person, have a little think about whether you want your career to be about making a difference in people's lives. I think once that question's answered, it takes a bit of hard work, but it will probably be the most rewarding career you'd ever have.
Wonderful, I couldn't agree more. And Craig, just back to you. You mentioned earlier about a budget of £1.49 for a 3-course meal for patients. Could you share some ways in which that's achieved?
Well, as I say, it's tough. It's a very complex thing, but what we have in our favour is that we serve 140 odd million meals a year. So the catering operation within the NHS is vast. And because of that, we have the economies of scale. So what we pay for, let's say bread or milk or all the basics, is considerably less than you would be paying in your high street supermarket. So that has to be understood. But it is a challenge, a constant challenge, because one of the recommendations in the hospital food review is actually that catering budgets are ring-fenced, because the NHS is always looking for cost savings, and it's wrong to be trying to cut us back any farther than we currently are. So that's an important thing. But yeah, it's you say to most people about the price that you get, nobody can believe you. But believe me, with professional management, working with the dietitians closely, we can do it. We can do it.
No, very impressive. And back to you, Leanne. I have an anonymous question in here asking, how do you incorporate new food trends into your menus within hospital catering?
Well, I mean, at the moment, vegan, like I talked about earlier, is becoming a trend and the way people want to eat. and our suppliers, some of them are really on board with this and have got a huge variety now of those meals. I think through COVID, they took the opportunity to take on chefs who came into their places and cooked up some meals, and they're the meals they're now supplying into healthcare, a lot of plant-based meals now. The only challenge we have got is that our aim is really to make sure that that patient does eat the food that we put in front of them. So do the elderly population eat this way, or is it just something that the younger population are, you know, is it a way of life they want to? So it's trying to manage how much of that to put on the menu really, and what the take up is, because you know, we all know that the value of a meal left uneaten is zero. So if it's not what the patient wants to eat, then we're not actually helping them on their way to recovery. So we do look at trends, we do try to incorporate them, but it's about the balance of how much we put on the menu of those new trends and how much, you know, patients really want them.
Wonderful, thank you for that. I think that's all we have time for. So I'll just hand back to Natalie to close the webinar. Thanks, everyone.
Thank you, Victoria. All that's left for me to say then is thank you so much to everybody for attending today. We really hope that you enjoyed the session and that you have managed to develop your knowledge on the cost sector in some way at least. I personally thought it was a great session. So thank you so much to all of our speakers, Craig, Leanne and May. And also thank you to the rest of the committee and to Lorraine, who helps us to do these sessions, gives us guidance, keeps us all in check. So thank you to Lorraine as well. Just a reminder that the survey will be popping up after the end of the webinar. So if you could spare a couple of minutes to let us know what you would like to see from us and any of your other thoughts, that would be brilliant. And if you'd like to find out more about Arena Futures, we are on LinkedIn. You can also give us a message on there as well. Myself and the rest of the committee will be more than happy to chat to you about what we're up to. So that is all from me, and just thank you so much to everyone again. Take care.
Thank you. Bye.
Thank you.
Bye.